Today we'll be dealing with Tetralogy of Fallot. Now, what determines the hemodynamics of TOF? It's mainly the severity of RVOT obstruction. Whether it's a mild TOF or a moderate TOF or a severe TOF is mainly characterized by the severity of RVOT obstruction. And to a lesser extent, hemodynamics is determined by systemic vascular resistance. So you need to know the relationship between cyanosis and murmur of PS. Let's take the example of a very mild TOF. Suppose you have a very mild TOF which has hardly any obstruction at the level of the RVOT. It's basically going to behave like a VSD with left to right shunt. So basically a large VSD with left to right shunt. So a very mild TOF where there is minimal obstruction at the level of the pulmonary artery, it's basically going to behave like a VSD with left to right shunt. So keep that in mind. When we are talking about mild TOFs, routine mild TOFs, there's going to be some sort of an obstruction in the level of the pulmonary artery. So when blood enters into the RV, it has two outlets. It can go into the pulmonary artery or it can go into the left ventricle through the interventricular to the ventricular septal defect. So here, most of the blood will go into the pulmonary artery and some blood goes into the LV. This is we are talking about a mild TOF. So most of the blood goes into the pulmonary artery and some blood goes into the LV. So this will be a right to left shunt. Since the blood is passing through a relatively stenosed pulmonary artery, this results in an RVOT murmur. Since only a small quantity of blood is going into the left system, you have a mild cyanosis. So mild TOF, that is a mild obstruction at the level of the pulmonary artery, will cause a majority of the blood still goes through the pulmonary artery. So it is passing through a stenosed orifice, so you have an RVOT murmur. Some blood goes into the left system, so you have a development of mild cyanosis. Now let's take the example of severe TOF. In severe TOF, you have severe obstruction at the level of the pulmonary artery. So basically you have very severe obstruction at the level of the pulmonary artery. So when blood enters into the RV, the majority of the blood is going to go into the left system through the interventricular foramen. Only some blood goes through the stenosed pulmonary artery. So you will have severe cyanosis because basically there is a large right to left shunt and faint RVOT murmur. Why? Because only very little blood flows through the pulmonary artery. So keep that in mind. So what I can say is the murmur and the cyanosis are inversely proportional to each other. So a very prominent murmur, you will have a mild cyanosis. No murmur, you can have severe cyanosis. We'll just see this. Mild TOF. Now very mild TOF, I told you, presents as VSD with large left right shunt. We are talking about mild TOF, that is mild pulmonary stenosis or whatever RVOT obstruction. RVOT murmur is going to be prominent because there is going to be more blood flow through the pulmonary artery, and cyanosis is going to be mild because of little right to left shunt. We're talking about severe TOF, which is basically severe RVOT obstruction. You will have faint RVOT murmur because only a small quantity of blood goes through the RVOT while the entire blood is mostly shunted to the right system. So the cyanosis is going to be severe. That is why I told you, whenever you have a very prominent RVOT murmur, you will have mild cyanosis. No murmur, you can have severe cyanosis. So keep this in mind. Very important relationship. They'll ask you, the murmur and the cyanosis are inversely proportional to each other. The next thing you should know is with respect to systemic vascular resistance. How does isotonic exercise and pregnancy influence TOF? Both cause vasodilation, that is systemic vasodilation. So what happens when there is systemic vasodilation? The aortic pressure is going to fall. And when there is aortic pressure is going to fall, there is going to be increase in right to left shunt. Cyanosis will deepen. That is why TOF tolerates isotonic exercise poorly and pregnancy has a bad outcome in TOF patients. So remember, whenever you have isotonic exercise or pregnancy, both cause systemic vasodilation. When systemic vasodilation occurs, aortic pressure falls, increase in right to left shunt, increase in cyanosis, and as a result, you have hypoxia and hypercarbia. So again, isotonic exercise is poorly tolerated in TOF. Pregnancy has a very bad maternal as well as fetal outcome. Now, one characteristic hemodynamic abnormality you should know in TOF is RV systolic blood pressure is equal to LV systolic blood pressure is equal to aortic systolic blood pressure. Why is that? It occurs mainly because the intraventricular communication is very large. So there is rapid equalization of pressures. So RV systolic pressure will be equal to LV systolic blood pressure, which will again be equal to aortic systolic blood pressure. Because of the large intraventricular communication, the RV, LV and aorta behave as one chamber during systole. So very important now, we should look at this extensively when you are analyzing cath studies. So again, cyanosis and murmur are inversely proportional to each other. Very important point you must know. It has been asked extensively. So this is the prominent murmur here. So minimal cyanosis. Small murmur here. So severe cyanosis. Again, remember, murmur and cyanosis are inversely proportional to each other.